I'm Dr. Loy Vaughan, orthopedic surgeon with Alabama Bone and Joint. Now we're going to talk about knee replacements. Typically, a knee replacement is done for osteoarthritis of the knee. And to be a good candidate for a knee replacement, you number one have to have pretty significant pain in the knee combined with moderate to severe arthritis seen on x-rays. If you have bad arthritis on x-rays but you don't have severe pain, then it's really not a good idea to have a knee replacement. We always try to do non-operative measures first, so anti-inflammatories, steroid injections, gentle exercises, and strengthening. If those things don't work and you have severe pain, we've tried everything else, then you're a candidate for a knee replacement. Now, a knee replacement does not have quite as good a success as a hip replacement. About 80% of people are happy with their knee replacements, so about 20% of people are not happy with their knee replacements. So it's not a perfect surgery, but it's something that we do when we've tried everything else and people still have severe pain and severe arthritis. The way that a knee replacement works, you make a cut in the front of the knee and open up the knee joint, and you take the end of the thigh bone off, replace it with this metal cap. Take the end of the shin bone off, replace it with a metal cap, put a plastic spacer in between, and that's your new knee joint. Sometimes you smooth out the backside of the kneecap. Sometimes you just leave the kneecap as it is. And you put it back together, and that's your new knee joint. There's a 1 to 2% risk of infection with a knee replacement. If a knee replacement does get infected, it's a pretty big deal. We have to take everything out, and it's a long process, and to try to get the knee back in place. There are things that we can do to try to decrease the risk. Having blood sugar controlled, bring BMI down a little bit, and some other things. The other complications that can happen with a knee replacement, the thing that we worry about the second most is probably blood clots. And after surgery, we generally put people on aspirin unless they have a risk factor for a blood clot, and then we put people on a blood thinner. After surgery, people generally stay in the hospital for one night, work with therapy, and when it's safe to go home, usually go home the day after surgery. There's a special dressing on the knee that has a suction device attached to it, and that increases blood flow to the surgical side and helps decrease the risk of wound healing problems and infection. That stays on for about a week after surgery, and then it comes off and you wash, and if the incision's looking good, the knee is washed with soap and water daily, dried, and covered with a clean dressing. At 2 weeks, we bring you back to clinic and we look at the incision, make sure it looks okay. Physical therapy starts the day after you leave the hospital and is continued to work on mostly range of motion, because knee stiffness is something that can be a problem after the surgery, so it's very important to work on range of motion. We get x-rays at the 6-week mark and continue therapy until we have good motion. Usually at about the 3-month mark is when people start feeling pretty good and happy that they had the knee replacement done. So it's a long process for sure, and something that we don't take lightly, and definitely only want to do if we don't have any other options and the pain is severe. The last time we get x-rays is usually about a year after surgery. I'm Dr. Loy Vaughan, orthopedic surgeon with Alabama Bone and Joint, and the best way to get in touch with us is typically by phone, 205-621-3778. You can ask for my nurse Regina or the front desk, and you can schedule an appointment or ask any question that you have, and we'll try to get back with you as soon as we can.